the resident in a sitting position, ready for me to remove the dentures. I'm going to put the call light under her pillow. I'm going to take a towel and I'm going to lay it across the chest. And at this point, I'm then going to put my gloves on to be ready. Now, I want this table very close to you and very close to her. Dentures are very expensive and we need to handle them with really good care. We cannot risk bringing those dentures from here to the table and risk dropping them. So I want you to have the Emerson pan in one hand. Now also, another thing I want to mention about the Emerson pan is that this never touches the resident, never touches the linen, never touches the bed. It's going to stay in your hand. And I'm going to get my gauze and I'm going to use my index finger and my thumb. But before I do that, I'm going to ask her, can you remove your dentures? You probably didn't hear her, but she said no. And so that I will remove them for her. I'm going to lift the top lip up and remove the top denture by loosening the seal and placing it into the Emerson pan. At no time is the Emerson pan touching any of the bed or the resident. I'm going to lower the bottom lip and I'm going to remove the bottom denture, loosen it, and I'm going to put it in the Emerson pan. The gauze then goes in the trash because we won't use it again. And I'm going to take the dentures that are in the Emerson pan and the denture cup over to the sink. I'm going to stand to the side so that you can see exactly what I'm doing. I'm going to take the towel and I'm going to place it into the sink and I'm going to turn warm water on. You will not really turn the water on, but you must say that you are using warm water. I'm going to put the Emerson pan and the dentures down into the sink along with removing the lid of the denture cup, and I'm going to put that down in there, kind of letting it all kind of rinse right now. Be sure that she sees you put the denture cleaner onto the toothbrush and you pick the top denture up and kind of hold it low. I'm going to hold it up where you can see it, but I want it low. And then brush the front and the back and all around. Rinse that denture and place it into the denture cup that's down into the sink. Then I'm going to get the bottom denture. I'm going to brush it, both sides, and I'm going to rinse it and I'm going to place it into the denture cup. Then I'm going to pick the denture cup up and you're going to look at the instructor and you're going to be sure, you're going to turn your water and you're going to make sure that you say there's cool water in the denture cup. This is a critical step. Such a small word saying cool water could cause you to fail this skill. So the dentures are in the cup with cool water. I've rinsed my Emerson pan out, kind of cleaned up my supplies. I've come back to the resident. And I would not want to put these nice clean dentures into a dirty mouth, so I'm going to provide mouth care. So I'm going to take my Emerson pan, maybe just a little bit of mouthwash if you want to, and just say, I'm going to provide mouth care for you. And that's all you have to say. Just keep it simple like that for this skill. And then I'm going to put this, I'm going to get this close to me because I'm going to put the dentures back in. So I'm going to take the denture lid off and the top goes, the top outside is what you want facing up on the overbed table. Then I'm going to take my top denture and I'm going to ask her if she can insert them herself. Again, you couldn't hear her, but she said no. I'm going to lift the top denture and I'm going to place that in. I'm going to lower the lip and place the bottom denture in. And then I'm going to put the top back onto the denture cup and I'm going to open the drawer and put it in the bedside drawer in the top corner closer to her. I'm then going to remove my towel, and as on any of the skills that I have taught you, when you remove a towel or a bed protector and you put it in the hamper, that is when you remove the gloves. I'm going to lower her back down. I always suggest to my students to always put the mannequins back into the position that you found them. a critical step. Give them the call light, wash your hands, and report and record.